This is how you do it actually. We are trying to perform a cesarean section on a mother, and we have in line a brain surgery as well. We are concentrating this mother is pregnant and the doc is performing surgery on this pregnant mother. As you can see, we have put the urinary bladder here. We are just cutting it. Okay, we are almost at the edge, at the urethra. We can see the ovary now. In real life, there will be much more blood, but now we don't have that much. That's good. Those liquids, those protect the baby. The baby is reside in that liquid actually. Now it's time for the baby to come out. We are now checking the head of the baby intact or if there is some complication, and also we are trying to see if there is no cord which is obstructing delivery. There is the baby. Can you guys see it? I can see it. There is the baby. I am so proud of it. Look at the baby and look at the umbilical cord. We have to cut the umbilical cord right now. Just cut it and let me deliver the baby to its mother. Now we are done here, and for the next part, we have to sew the things that we have cut down, and there is a placenta. Here is where the baby lies, or the stuff that the mother eats, or the ingredients or the nutrients come towards the baby. Those are kind of the waste product also while delivering a baby. Now there is ovary. Covering it with swab, and now we have to tie an anchor knot at the angle of the uterine incision. Now continuous interlocking sutures are used to oppose the deep myometrical and minimal decidual layers of the uterus. We have to just sew it properly. Now we have to suture a second layer so that it's get properly. Now we have to confirm if there is no internal bleeding or hemostasis. We also take care of the adjacent portion, as we can see. That's right. Now we have to we put the ovary back in the place. Now we have to see whether there is anything else. Now just one part remaining, that is sewing the skin that we have cut through the scalpel. Yeah, that's right. That's how we do. I can assure you there is in line a brain surgery that we have to perform. And we are done here. Up to the brain surgery. Now the brain surgery is starting. We have to position the patient properly. This is the second surgery we are performing today. Just propping the patient, and now we have to attach the skull clamp to the patient, which protects the skull and holds it together while we are performing the brain surgery. Selecting the base unit there. Now we have to attach the base unit to the operation table, like that. This is how we do, guys. Now we have to cut the hair with the surgical trimmer. We are just only cutting the half of the head. Now we have to also put a gauge paper inside the ear. Now you have to get a surgical scrub and wash it. This is a portion we should have to cut to prevent hemostasis and the pressure, relieve the pressure from the brain. This is a very important surgery and very careful. We have to be very careful here. Now we will be scrubbing the chlorhexidine solution, which will remove all the infection if there is any. Because of brain surgery, we cannot take any risk. Just marking the portion that we should cut. And now I have to drape the operative field. We have to attach the sterile plastic adhesives so that it could attach to the skin. Now we can just see only the brain. We are performing this with the local anesthetic only. Now I have to select the scalpel there. Now the cutting would start. I can assure you there is much more bleeding, guys, and this is just a simulation we are playing, but in real there will be much more bleeding. I can just imagine. We have to pull the skin so that we can get entry into the skull. Right, this by this way. Okay, we got the scissors. Now we have to cut the plane. Now it acts as a protective barrier between the superficial fascia or the skin. Yeah. Now we'll use the electrocautery pen to just remove all the thing and burn through it. It is very much sterile and there is no chance of infection. This is a very complex surgery. This is a very important part, pulling the skin. It is very, tough also. Yeah, we can now see the skull. I can just imagine this is so. Okay, the preparation is almost done. Now we have to break through the skull, I guess. These are the towel clamps. We are just selecting with a dry gauge right now. Now let me take a moment to prepare for the next part. Wow. Okay. Now for the phase 2, we are using the drill and a syringe with saline to wash it and then break through the skull. Just like this. This is very dangerous and you have to be very careful. Wow. Now this is the dissector. We'll just lever it up. My heart is beating so fast. In this simulation only. Now I have to attach the B1 foot to the drill. Okay. Now we can open the skull, I guess. My heart is beating so fast, guys. Heart is beating so fast. This is it. Now I have to use a bone wax to control the bleeding. Like this. We still haven't gone through the skull, which is much more important. This would remove the bleeding on the electro. Now this is the number 11 scalpel, a very fine scalpel to cut through the epithelial or the layer above the skull. like this. Oh shit. We have to cut through like 5 of them. 4 done and the last one. Okay, for the next part, I guess the skull is now open. Now I have to remove the weight swabs. We have to swap a syringe with a saline solution. This is the way. There is much more bleeding, I guess. The pressure is already relieved because we have opened this. Now we just have to put the skull back in. This is, just to relieve pressure, we have to crack open the whole skull. Can you just imagine, guys? Can you just imagine? Now we gotta remove the screwdriver there. Yeah, by this way. Now we have to seal with the electrocautery forces. Yes. Now we have to attach the skin. This is the last portion. Our brain surgery is almost done. Just have to sew through the fascia and the skull. Yeah. Just have to seal this through and remove any kind of bleeding there. Now we can just staple through it. This is a staple gun. And for the next part, I will just show you how you drill through the skull once more. This is it. Wow. This is how we break open the skull. Anyway guys, our brain surgery is done. The patient is probably well and we are going. Till then, goodbye guys. Goodbye.